Hello, everyone. Welcome to Gross Anatomy of the Musculoskeletal System. I'm Dr. Cosby, and I'm excited to be teaching this gross anatomy course because it is near and dear to my heart. I get all of the athletic training students and MS kinesiology students, and so I couldn't be in a better class. I'm with students who wake up thinking like I do, wanting to fix people, wanting to improve performance, right? Wanting to get them back to participation as soon as possible. So I'm excited to be teaching this 8-week course with all of you. I'm doing something a little bit different, so hopefully it works out. Let me know if it doesn't. On the right-hand side of the screen, you'll see the PowerPoint, which will be driving most of what I'm going to be talking about. But then I thought it was important to pull up the Canvas course so you could see kind of what I'm talking about at the same time. But I'm Dr. Cosby. I am the program director for the athletic training program here at Point Loma Nazarene University, but I'm also a faculty member in the Anatomy Learning Institute. The Anatomy Learning Institute is the institute on our campus which houses all of the anatomy courses on the graduate side. So that would be this course right here, which is athletic training and kinesiology driven, the physician assistant gross anatomy course, the occupational therapy gross anatomy course. So all of those courses are housed here, and that particular institute is directed by Dr. Joy Balta, and we'll talk about him in just a second because he guest lectures often in this particular course that you will be taking. But I'm Dr. Cosby. Like I said, I'm really excited to be taking you through this journey of dissection, of getting to know the human body a little bit deeper, getting ready to explore all of the things that you've read about, seen, maybe even visualized, and now you're actually going to take that visual and actually put your hands on it. So I don't know if you're excited, but I am way excited about this. So let's talk about the format of the classes. And I think this is why I split the screen so then you could kind of see what I was talking about all at the same time. Your lectures will all be online and they'll all be in Canvas. And this was from previous student evaluations, which said, please stop spending time lecturing in the course. We just want to dissect. We want to dissect. We want to dissect. And 3 hours, believe it or not, goes by pretty quick. So this year is the first year that we have created fully online lectures for you to engage in the content. And Dr. Balta volunteered to do that. And so I said, yes, Dr. Balta, take it away. So our lectures will be fully online for this course, and they will all be taught to you by Dr. Balta. So I'm moving to the module section in our Canvas course, and I'm going to scroll down to our units. And so our course will be broken down into 3 different units. Unit 1 will cover the thorax and the abdomen. Unit 2 will cover the upper extremities. The last unit will then cover the lower extremities. And then within each of those units, you'll see which week of the course we're actually on, and then anything that we want you to do within that actual week. And so I think I set this up at least in a way that makes it easy for you all to follow. So week 1, we just have 1 lecture this week because we have a holiday on our first meeting period. And so that's going to be the lecture, the introduction, and superficial back muscle. So if you click here, what I mean by online lectures is that Dr. Balta will have 3 lectures where he will be lecturing to you about the back and the thorax. And so your responsibility will be to watch Dr. Balta's lectures, as you can see them there, right? And then in addition to that, I had the unique experience of then being able to actually teach you on the donors, everything that Dr. Balta was talking about. So I will then take you through the donor so you can see what it should look like when you're actually dissecting. So Dr. Balta and I really did a good job kind of tag teaming. Yes. Okay. So as I go back to the modules, and as I said, the lectures will be online, and each of those lectures will kind of have like what we call as a due date. And you can see that there. So I want you to watch these first series of lectures the Wednesday before you come into class on Thursday, right? And then we also have dissection checklists, which are going to be utilized in the lab to help guide you. What should you be looking for? What things should you be identifying while you're dissecting? Because we recognize that you can get lost in dissection, right? So the goal is to make sure you're not getting lost in the dissection. The next thing are our lab practicals and our dissections. So our dissections will take place on the main campus in our gross anatomy lab, which is located in Rohr Science 165. If it's your first time to our Point Loma campus, just stop by our guard shack and ask them where Rohr Science is. They should be able to direct you. Your practicals and your dissections will all take place in our gross anatomy lab on the main campus. And so what do I mean by practicals? So every time you dissect, anytime we finish a unit, then you're going to have a written quiz for that unit, right? Which is going to be based on the lectures in that unit. And then you're also going to have what we call is a lab practical, where you're actually would identify structures and be responsible for knowing origin, insertion, action, innervation, for example, of those structures, right? And then if for some reason you're in a group of students and you are just struggling to get through like the dissection for the week, right? So let's say if we're in week 1 and we're supposed to get through all of the superficial back muscles by the end of the class period, let's say you can't get through all of them. For whatever reason, you're struggling to get through. You can have access to the dissection lab after hours. I'm happy to grant that to you. If you feel like you need it, then I'm happy to work with you to get you access to our lab after hours. It's an amazing advantage, right? Okay, so general information. A few things that I really think is important for you and I to be on the same page is making sure that you just read your course syllabus, right? So this is our homepage. If you click on that syllabus tab, it'll take you to the course syllabus. The course syllabus to me is my contract to you. It's how I'm going to live life with y'all for the next 8 weeks of our class, right? So you'll see institutional learning outcomes, program learning outcomes, but more importantly, probably to me is like, what is the course kind of laid out as? So as I mentioned, we're going to break the course down into 3 units over 8 weeks of time. We're going to start with the back and the spinal cord. We're going to work into the upper limb. And then finally, my favorite segment, the lower limb. So we'll end with that. And then, as I've already mentioned, the lecture sections will be fully online, asynchronous. And then our lab sections will be face-to-face Tuesday, Thursday from 8 a.m. to 11. If you haven't had a class with me, then you know my biggest pet peeve is being late. So please don't be late to your class. I will make sure not to end late. So I will respect the end time of 11 o'clock. You can also see how you'll be graded and how things are going to be weighted in our class, right? So we have written quizzes, which we said there's 3 of them, 1 for each unit. We have 3 lab practicals, 1 for each unit. And then we have 4 different discussion boards embedded throughout the class. So you can see, I hope what you're seeing is I'm not trying to give you a whole bunch of busy work. The goal is for you to be diligent in your studies, to be creating charts. We're going to talk about that next, and having good study habits, and then be prepared for your written and your lab practical exams, right? Okay, so make sure you understand the syllabus. Make sure you understand your module or layouts. I'm going to pull those modules up so we can go through those briefly. Have a course introduction. So if you want to rewatch this video, feel free to do that. But I'm also going to send it in an announcement. You can look here and see what required materials and recommended resources are for this class. And so I must say this is the first year I have to get used to this, where we're not requiring an actual textbook for this course. So I have to get used to this. I'm sure y'all are all going to have to get used to this too. So I'm going to skip to the next slide, and I'm going to tell you the justification for this. What the research shows is that every student in our class, I think there will be 19 or 20 of you, you have different learning preferences, different learning styles, and you know what works for you. So prescribing one textbook for anatomy when anatomy varies becomes very challenging in a gross anatomy dissection course. So we're not actually requiring a textbook. Athletic training students, however, if you bought the Atlas or Moore's Clinical Anatomy, keep them. You will still utilize them throughout the program, okay? With that said, here are the resources that we're recommending that you use to guide your study. This Anatomy and Physiology OpenStax, which is actually a free resource, beautiful. And then we also have the Visible Body courseware, which you can see here in the Canvas course. So there's Visible Body here, and you can get 20% off of that. I don't know how much it is per 3 months. It's a 3-month subscription, but I can tell you I subscribe to it as well. I actually use it to do a lot of the deeper anatomy teaching in our athletic training program. So I do recommend it if you want something to supplement kind of your learning. This would be one of the best kind of ways to to do that. So what would make you a good student in this class? What do you need to get an A? That's always the question that every student has in the back of their brain, right? Like, what do I need to do to get an A? You need to take notes on all of the online lectures. You need to create tables which say have all of the muscles, the origin, the insertion, the actions, the innervations, right? And you need to own those. Maybe even drawing out illustrations would be good for you. But take all of these items that we're giving you, right, and figure out what works best for you to actually be owners of each of the segments that we're going to be covering in this class. There's not a one size fits all approach. I'm happy to work with you all if you need help kind of parceling out information and putting things together, because I know we're all going to be excited about getting in and really dissecting and moving through the different units of the course. I kind of wanted to lay the class rules out so that we have an understanding of what would be appropriate in professional behavior in a gross anatomy lab, because it is so different than a traditional classroom setting. So you, at all times, be on your best behavior, right? That means being appropriate and professional at all times. No, donor jokes, no removing, let's say, coverings from the genitalia of the cadaver, no taking pictures when I'm not looking, right? No music in the lab. Those would all be things that would be inappropriate behavior. We're going to be in our best behavior. We're going to be good stewards of our donors who have donated their bodies so that you all can do research and get excited and learn more about the human body, right? The recommendation is to buy scrubs, but I don't always make students buy scrubs. You can wear an old pair of jeans or an old pair of sweats. Short sleeves is preferred. In long sleeves, they tend to get wet. Keep in mind, our donors are embalmed. And so as you start to incise, fluids will come out of our donors. And so that tends to drip off of the table onto the floor, and it will splash sometimes. So wearing clothes that you don't necessarily care for would be great. Your shoes must be closed. That does not include Crocs. I know we all love our Crocs and they're very comfy, but that does not include our Crocs because the Crocs actually have holes in them. So it must be closed-toed shoes. To be safe, tennis shoes and or boots will work. The Anatomy Learning Institute will provide gloves, mask, and a face shield when it's needed, but gloves at minimum should be worn when actually interacting with our donors. At no point in time should you ever have the following out: a cell phone, any food, any drinks. So if you want to use your cell phone, you must walk outside of the lab, even if it's to text, even if it's to check your email, the phone should walk with you outside of the lab so that there isn't any temptation to take images of our donors. That is actually against the rules of the Anatomy Learning Institute. So we want to uphold those rules wherever possible. Same thing with eating and drinking. Eating and drinking around the donors is prohibited. You can drop drinks into the actual donor or food, right? And so we don't want to create, a non-sterile environment for the donors or for you, for example. So if you need to drink water, if you need to eat a snack or something, just take it outside of the lab, eat your snack, and then come back in. And then contact lenses are kind of a gray area, but here is my recommendation. Because the donors are embalmed, and there are times where like maybe something you're working with drops on the donor and there's a splash and it goes into the eye. Then you have to take your contact lens out. You have to rinse the eye, and most often that contact lens is contaminated. So the recommendation for at least gross anatomy is to wear your actual glasses to the lab as opposed to your contact lenses. If you are expecting, congratulations, we're really excited for you. But we also need a physician release note, which states that you're allowed to work with the donors. And that's just to protect you and the human being that is growing inside of you. And then last but definitely not least, the last four really are about closing the lab down. So when we're done dissecting, there is protocol. We need to check all donors to make sure none of our tools that we were using to dissect are left in the actual donors. We want to make sure that those tools that we use to dissect are also cleaned at the end of the night. We want to make sure all of our the tables are wiped down, both the donor tables and the actual student tables are wiped down, right? And then once we've done that, we can turn off the lights and we are ready to go into our actual day. So these are lab rules. All that to be said, I'm excited, way excited. Every year when I do this, the first week is usually a little rocky, and then you all get I call it the surgeon's hand, where you understand just how much force is required to dissect, and your dissections are just beautiful. Things to note for me: don't be afraid to make a mistake, right? There's no such thing as a dumb answer in my class, and I can't wait to see you all. Looking forward to our 8 weeks together.